Welcome to this channel. We have discussed the classification based on the histological morphology, that is WHO classification. In this video we will talk about the other classification. Now if you see, the depth of invasion is very important. Depth of invasion, and depending on this, gastric carcinoma is divided into early gastric carcinoma is the early gastric carcinoma and advanced gastric carcinoma Now in early gastric carcinoma it is associated only, or it is limited only with the mucosa and submucosa plus perigastric lymph node metastasis. So this is the early gastric carcinoma. Remember, it is very good prognosis, but it is not as a carcinoma in situ. Okay, and advanced carcinoma, it is beyond the submucosa. And it is divided into 4 types depending on the Borman classification. BORMANN, Borman classification. In the Borman classification, they divided into PF, polypoidal, fungating, ulcerative and infiltrative. So they have divided into polypoidal growth, the fungating growth, ulcerated growth and infiltrated growth. So this is the 4 important division of Borman classification in advanced gastric carcinoma. Next we will talk about the macroscopic appearance of this gastric carcinoma classification. Macroscopic. Okay, in macroscopic classification they divided into type 1, type 2 and type 3 classification. Type 1, it is a fungating or exophytic growth. We call it exophytic growth. And type 2 is either flat. It is divided into 2A, B and C, which is slightly elevated. One is B is flat and C is slightly depressed. Okay, slightly depressed. And type 3, it is excavated. Excavated means it is deep down to the tissue. So this is according to the macroscopic appearance. Now here what we will see the mucosa, the surrounding mucosa will be nodular and raised. This is the mucosa. If you see the margin, margin is the beaded appearance. And heaped up margin. And if you see the base of this ulcer, it is necrotic. So this is the type 3 gastric carcinoma as according to the macroscopic appearance. Number 4, we will talk about the histological subtype. Now histological subtype is called as a Lauren classification. LAUREN. It's Lauren classification. Here it is divided into intestinal and diffuse. There is intestinal and diffuse. And in intestinal there is a polypoidal growth. Or ulcerated growth. And what we will see there, we will see the mucin. There, and apical mucin vacuoles we will see in the intestinal type. Okay, and in diffuse type what we will see, there will be diffuse infiltration of the tumor throughout the stomach wall, and there will be no exophytic growth. So it will be a desmoplastic change throughout the stomach wall, and it will look like a leather bottle appearance, or we call it as a lenitus plastica. Due to diffuse infiltration, there is a desmoplastic change throughout the stomach wall. So that is called lenitus plastica. Now what we will see, if you see, this is that is called signet ring. Now if you see, this is the mucosa of the there is a mucosa of this gastric, and there is a cell there, and we can see there is a mucin. And intestinal, it is called as there is intestinal metaplasia. That means there is a development of the gland. It is look like a glandular structure. and there is a mucin, and if you see the cell apical portion, there will be a one mucinous part, we call it apical mucinous vacuole. So this is the importance of this one, gastric carcinoma. And another important is called signet ring type. Signet ring type means if the cell is there and there is excess amount of mucin, and that mucin will shift the nucleus, in a periphery that looks like a signet ring, what we call it as a signet ring appearance of the gastric carcinoma. So this is all about the classification of the gastric carcinoma depending on the histological subtype, histological feature, and gross feature, and the depth of invasion. According to this is divided 4 different gastric carcinoma. We have talked everything about there. Thank you.